Various contributors to the Money and Business Show and related programs are not to be considered as endorsed by Radio Shalom, its employees. Visitors to this program are urged to use their own discernment to draw their own conclusions. Please read your prospectus and consult with your own investment advisor.
Live from the studios of Radio Shalom, 1650 AM in Montreal, Canada, the city of Joie de Vivre, the world capital of culinary variety, and the home of the Montreal Canadiens. This is the Money and Business Show with your host, Samuel Ezerzer. Every week, Samuel and his guests discuss money, investments, financial services, and the world economy. Over the next hour, you can have your questions about business and personal finances answered. So call 514-738-4100, extension 200, to speak with Samuel and his guests. And now, here is the host of the Money and Business Show, Samuel Ezerzer.
Money and business. It gives me great pleasure to introduce our guest speaker today, Dr. Jason L.Skolar, who is a doctor of chiropractic and a very well-known and respected healthcare professional here in Montreal. Dr. L.Skolar has a very well-known reputation for treating celebrity figures and professional athletes who compete at a highest level of physical performance. His patients include celebrity figures, Hollywood producers, television announcers, NASCAR drivers, professional musicians, gymnasts, national and provincial champions, Olympic figure skaters, martial artists, weekend warriors, busy executive healthcare professionals from all walks of life. My name is Samuel Ezerzer for the Money and Business Show, Radio Shalom, CJRS 1650 AM in Montreal. We're tuning live with our studios headquarters in Montreal, the financial capital and the home of the greatest hockey team, the Montreal Canadiens. We have another great show for you today. And as always, you can call if you have any questions, comments, or criticism on today's topic. Please call us directly at 514-738-4100, extension 200, or you can email at moneyandbusinessshow@gmail.com if you have any inquiries. You can also visit our website at www.radio-shalom.ca. All our shows are archived there. Today I'm going to introduce Dr. Jason L.Skolar. Is an avid martial artist himself and is currently a ranked practitioner of Wing Chun Kung Fu. He's also the official doctor for the Wing Chun Montreal Sunny Tang Kung Fu Academy. He has special interest in the field of mixed martial arts and treats many high-level martial artists who compete both at the provincial, national, and professional level. Martial arts has always had a special place in his heart since a very young age. Dr. L.Skolar was a regular guest speaker on radio for 2 years, educating the public on a variety of health-related subjects. He conducts regular health and wellness representations on stress management, the importance of good posture, and how to integrate exercise and good nutrition into our lives on a daily basis. He also is a motivational speaker dedicated to helping people of all ages overcome self-limited beliefs and obstacles, as well as how to discover their passion and purpose in life. Dr. L.Skolar has 2 practices in both Montreal and South Shore regions. So today, our topic today is how chiropractors save the government billions of dollars each year, and how can chiropractors help get rid of the pain? Well, back pain is one of the most common health complaints, affecting 8 out of the 10 people at some point during their lives. The lower back in the area most often affected. For many people, back pain goes away on its own after a few days or weeks. But for others, the pain becomes chronic and lasts for months or years. Low back pain can be very painful and is a challenging condition to diagnose, treat, and study. The total annual cost of low back pain in the United States and also in Canada, including lost wage and reduced productivity, are more than $125 billion. So today I'd like to introduce Dr. Jason L.Skolar. How are you?
How are you, Sam?
Good. Welcome back, and welcome back on our program again.
thank you so much for the encore. I really appreciate you inviting me to come back for a second presentation. I had a lot of fun doing it the first time, and it's always a pleasure to be here to share with the world what I love to do most in life, which is helping people and helping empower people on how to make better decisions for their health.
Exactly. Now, before I ask you a question, we're just going to hear a clip from the doctors. Dr. Mancini discusses the benefits of chiropractic. Go ahead.
I've had back pain on and off for at least 5 years.
We're going to really evaluate where this pain is coming from, because the pain may not be what you think it is.
If you've tried everything but your pain still isn't going away, don't give up, because the pain may not be what you think. And our next guest is desperate to get rid of her lower back pain once and for all.
Hi, doctors. I've been suffering from chronic lower back pain for what seems like forever. I get massages, but the pain always comes back. This is taking a huge toll on my life. Is there anything you can do to help me get rid of this pain? Please help.
So what we're going to do today is we're going to really evaluate where this pain is coming from, because the pain may not be what you think it is. One of the things that I had to share with Beverly is the fact that the pain is not the problem. The problem is the fact that the body communicates through the nervous system, and that it just lets us know that there is a problem inside. But the pain itself is not the problem. And when we see the animation of the nervous system, we see that the pain travels all through the brain, throughout the whole spinal cord, and it shows through all the impulses that are communicating back and forth from the body to the brain and the brain to the body. But I also know that there's some of the individuals, so we're trained to actually find the cause of that problem, which we call subluxations, which are the misalignments in that, and then we just correct it. And I know that there's some people that are afraid to go to a chiropractor, because sometimes they see that the noise that is produced after an adjustment is a little bit scary. But what I did with Beverly is also I introduced this unit that is called an activator. And it's a very simple unit that has a very little rubber end. And then we just went to the little segments in her spine, just like that. And that allowed me to correct the misalignments and the subluxations, and that's what gave her the relief that she now has. Because the cause of the pain was not necessarily in her back. Actually, in our exam, we found out that most of her cause was coming from her upper back and her neck and some of the other stresses that we found chemically and emotionally.
Jason, we just heard a clip here. Why are so many people scared to go to a chiropractor? Why?
That's a great question, Sam. There are many misconceptions that surround the field of chiropractic, and that is due mainly as a result of ignorance and lack of communication between the medical profession, the chiropractic profession, and other health-related professions as well. It's important that all healthcare professionals sit together at the same table and we start to educate each other based upon what it is that we do. Fear, as the term stands for, FEAR, meaning false evidence that appears real. Some people are afraid to do things in life simply because they have a certain preconceived notion that there may be a certain inherent amount of danger with that particular thing, whatever it may be. And in the face of chiropractic, people often hear some negative publicity on TV because, let's face it, if, like we heard in this segment, if a person has terrible low back pain and they're scheduled for surgery and they're completely desperate, they don't know what else to do, they've consulted the top neurosurgeons on the planet, and they've all been told the same thing: stay away from chiropractors, you have to have surgery. And in the patient's mind, they're going to believe that, first of all, the MD told me to stay away from chiropractors, so I have to stay away from chiropractors, and I'm going to need surgery, so that's really the only thing that's going to help me. When in fact, there are gross misconceptions that surround what it is that we do. The important thing is to educate the public as well as other healthcare professionals as to the safety and efficacy of chiropractic. Chiropractic is safe. Do you think that there is a greater risk of seeing a chiropractor and having a very negative, serious adverse reaction to treatment compared to going to the hospital for a surgical procedure? You can't even compare the two risks. So fear in the minds of the public really plays a significant role, and this is largely due to some of the negative publicity that portrays at times what the profession is all about. And I tell all my patients and people who seek out my care and anyone who calls me for a consultation, I have videos that I posted on YouTube, and I kid you not, in the last month I've received phone calls from the Philippines, from Washington, from Mississippi, from Missouri. I'm delighted to say that these videos have become viral. These videos are reaching all across the globe. And I have other doctors who are calling me, asking me about a particular technique that I use when I treat vertigo. And it's all about education, and it's all about helping people understand what it is that we do. Chiropractic is not dangerous. It is not. It doesn't carry with it tremendous risk. Chiropractors are board-certified, licensed healthcare professionals that have undergone rigorous formal education. And we have the same formal educational training as that of a medical doctor, with the large exception being that we don't use a pharmacological intervention when treating patients. We don't use drugs. We don't use invasive procedures. Everything we do is hands-on in natural therapy. So this negativity that surrounds perhaps the professional image comes from a lot of miscommunication on the media's behalf and these extremely, extremely rare events that may occur as a result of a therapeutic intervention that will alarm the public and that will be discussed on a public broadcast. And if someone is scheduled for surgery and they see a chiropractor and their condition is completely resolved and they're able to regain regular function within their activities of daily living, you're not going to hear about this on Pulse News. You're going to hear about that 1 out of 15 million that unfortunately may have had a stroke or may have had an adverse serious reaction. And it's the sad truth. But the truth of the matter, Sam, is that I treat medical doctors, I treat dentists, I treat people from literally all walks of life. And the important thing is to sit down with people, dispel the myths, dispel the fear, speak about the truth behind the profession, talk about the research, and explain in detail what it is that I'm going to do when I propose a therapeutic plan of management. And guess what? People respond. People get well. And chiropractic works. Despite all of the negative opinions that exist in this world, it works, it's safe, it's effective, and we need chiropractors on this planet. Well,
somehow it worked for this woman here, but she, the lower back pain, but the pain was misaligned because the pain from what the chiropractor said was it came from in another place, from the upper body, not from the lower body.
We have in the body, in the human body, we can think of the nervous system. We can liken that to an electrical panel and fuse box in a house. You have a main electrical panel with wires that disperse throughout the entire house. And you have wires that go into the garage, into the air conditioning unit, into the hot water tank, into the kitchen. In all parts of the house, there are electrical wires. And we know that these wires basically control the flow of electricity throughout the house. And the main flow of electricity, as we know, is controlled within that fuse panel. That's where the main electrical circuits are found. And because a problem may occur, for example, with the lighting in the kitchen or with the lighting in the garage or in an appliance, it doesn't necessarily mean that the problem is with the appliance. It could be within the electrical conductivity in the house, or it could be with the fuse box. So chiropractors are experts in the field of neuromusculoskeletal medicine, whereby they're trained to find the origin and cause of pain. That's what makes what we do so important. We don't medicate symptoms. We don't give a drug or recommend a drug because a person has low back pain. If you put a Band-Aid on a problem, you're not treating the cause of the problem. You are just covering the symptoms. In order to heal completely and totally of any particular problem, you have to treat the underlying cause. So what this other doctor was alluding to was the fact that this woman, because she was experiencing low back pain, based upon his thorough physical examination, he found that the pain, the origin, wasn't coming from the back. It was coming from another part of the body.
Exactly. Jason, I want you to stay on the line. We're going to go to a commercial. This is Dr. Jason L.Skolar. He's a chiropractor here in Montreal. Again, my name is Samuel Ezerzer for the Money and Biz Show on Radio Shalom. CJRS 1650 AM in Montreal. We'll be right back in 2 minutes.